When a woman's body becomes less responsive after menopause, when sex becomes more complicated, more painful, or more distant than it used to be, most men draw the wrong conclusion. They conclude it is about them, or they conclude it is just age, or they stop trying altogether. All three conclusions are wrong, and all three cost the relationship something it did not have to lose. Because here's the truth that the research shows, the truth that the women I work with in my clinical practice have been trying to communicate to their partners for years without always having the language to make themselves fully understood. She has not lost interest in intimacy. Her body has not given up on pleasure. And she is not trying to signal rejection, indifference, or the end of that chapter of your life together. What has changed is not her desire. What has changed is the conditions under which that desire can emerge, the approach required to meet her body where it now is, the emotional and physical environment that allows intimacy to feel safe and satisfying, rather than uncomfortable or pressured. And most men, through no fault of their own, through nothing more than a lack of the right information, are not yet providing those conditions. Today, I am giving you the right conclusion, and exactly what to do with it. Welcome back to the channel. If this is your first time here, my name is Dr. Julia Rhodes. I am a certified men's sex therapist with over a decade of clinical experience working with men and couples across all stages of intimate life. The work I care most deeply about, and the reason this channel exists, is helping men over 60 understand what is actually happening in their intimate relationships and giving them the specific, practical, research-backed knowledge they need to show up for their partners in ways that genuinely work. This video is one of the most important I have created on this channel, because what I am about to share is not speculation or generalization. It is drawn from clinical research, from large-scale survey data, and from the direct, honest voices of post-menopausal women who have told researchers and told me exactly what they need from the men in their lives. What women actually want in bed after menopause is not mysterious. It is not complicated. It is not beyond any man's capacity to provide. It simply requires knowing what it is. And today, I am going to tell you. Before we go any further, if you are a man over 60 who wants to truly understand the woman he loves, who wants to navigate the changes that menopause brings with knowledge and confidence, rather than confusion and silence, this channel was built for you. Every single week, I release new content specifically designed to give men like you the honest, research-backed, clinically grounded knowledge that most people never receive. Hit that subscribe button right now and turn on your notifications, because today's video is one of many, and every single one of them was created with you in mind. Subscribe. Let's get into the research. What menopause actually does. Before we talk about what she wants, we need to talk about what her body is navigating, because the wants are inseparable from the biology, and men who understand the biology respond to their partner with a completely different quality of patience, compassion, and intelligence. Menopause, defined clinically as 12 consecutive months without a menstrual period, marks a profound biological transition. The ovaries significantly reduce their production of estrogen and progesterone, and testosterone levels also decline. These hormonal shifts trigger a cascade of physiological changes that directly affect sexual function, sensation, arousal, and desire. The average age of menopause onset is 51. This means that the majority of women in relationships with men over 60 are navigating some stage of this transition: perimenopause, menopause, or postmenopause. Understanding what is happening in her body is not optional background knowledge for men in this age group. It is foundational. One of the most significant and least discussed consequences of declining estrogen is vaginal atrophy, clinically now termed genitourinary syndrome of menopause. Estrogen maintains the thickness, elasticity, and lubrication of vaginal tissue. As levels decline, the tissue thins, loses elasticity, and produces significantly less natural lubrication. Research shows that up to 50% of post-menopausal women experience these symptoms, including vaginal dryness, burning, and pain during intercourse. Yet studies consistently show that fewer than 25% of affected women discuss it with their doctor, and fewer still have partners who understand what is happening or how to respond. Sex that was previously comfortable can become genuinely painful. This is not reluctance, this is physiology. And men who do not understand it will consistently misread their partner's response. Beyond the physical changes, the pattern of desire itself shifts. Research by Dr. Rosemary Basson established that female desire, particularly in long-term relationships and particularly after menopause, operates primarily through a responsive model rather than a spontaneous one. Spontaneous desire, the unprompted experience of wanting sex, becomes less common. Responsive desire, desire that emerges in response to stimulation, emotional connection, and the right context, remains fully intact. Men who wait for their partner to initiate or demonstrate spontaneous desire will wait increasingly long. Men who understand responsive desire and create the conditions for it to emerge will find their partner's sexuality very much alive. This is the biological landscape. Everything that follows is a map of how to navigate it. What she wants. Number 1, time and patience. The first and most universally expressed thing that research shows postmenopausal women want from sexual intimacy is more time, not more frequency. More time within each intimate encounter. More patience, more willingness to let the experience unfold on her timeline rather than the timeline that felt natural in earlier years. Here is why this matters biologically. After menopause, the reduced estrogen environment means that arousal, the physiological process of genital engorgement, lubrication, and sensitivity, takes longer to develop than it did before. The vascular response is slower. Natural lubrication, if it occurs at all, arrives more gradually. Nerve sensitivity in the genital tissue has changed. The body needs more time, more deliberate stimulation, and a more unhurried approach to reach the level of arousal at which physical intimacy feels comfortable and pleasurable rather than uncomfortable. Most men, particularly those operating on the timeline and approach that worked in their 30s and 40s, move through foreplay in a matter of minutes. For many postmenopausal women, that timeline is not sufficient. And when intimacy proceeds before her body is ready, the experience can range from merely unsatisfying to genuinely painful, which compounds her reluctance and further reduces her desire to engage. Multiple large-scale surveys of postmenopausal women, including research from the North American Menopause Society, confirm that more time, more foreplay, and more patience are among the most consistently requested things from their partners. Not exotic techniques, not new positions, more time. What you can do is straightforward. Slow down. Deliberately, consciously, almost uncomfortably slow down. Begin every intimate encounter with the assumption that you have all the time in the world, because in the most important sense, you do. The destination can wait. The experience of getting there together is the intimacy. Let it breathe. Let it build. Let her body arrive in its own time, and trust that when it does, what follows will be worth every patient moment of the journey. What she wants. Number 2, emotional presence before physical touch. The second thing that research shows postmenopausal women want is something that goes beyond physical technique entirely, and that most men significantly underestimate in its impact on her intimate experience: emotional presence before any physical touch begins. A landmark study published in Menopause, the Journal of the North American Menopause Society, found that emotional intimacy was the single most cited factor in sexual satisfaction among postmenopausal women, ranking above physical technique, frequency, and even the absence of physical symptoms. Read that again. Above physical technique, above frequency, above pain-free sex. Emotional intimacy. What this tells us, and what the research in postmenopausal female sexuality confirms consistently, is that for women at this stage of life, the emotional context of an intimate encounter is not a warm-up. It is not a preliminary to the real thing. It is the most significant determinant of whether she is able to access desire, arousal, and satisfaction at all. Women after menopause do not want less emotional connection during sex. Research shows they want more. And the emotional presence that makes the most difference begins long before the bedroom. It lives in the texture of daily life together, in the quality of your attention during dinner, in whether you are genuinely present in conversation or physically there but mentally elsewhere, in whether she feels seen, valued, and desired as a whole person, not just as a physical partner. For men whose intimate approach has been primarily physical, who approach intimacy as something that begins with physical initiation and proceeds from there, this finding requires a genuine recalibration. Because for your partner at this stage of life, the intimate encounter effectively begins hours before you touch her. In the way you looked at her across the room, in the conversation where you were fully present, in the moment you said something genuine that told her you see her, you value her, and you want her. Create that emotional context consistently. Make her feel your presence, not just your desire, in the hours and days before intimacy. And watch what happens to her responsiveness when you finally reach toward her. What she wants, number 3, a partner who understands her body. The third thing postmenopausal women want is a partner who actually understands what is happening in her body, not just emotionally, but anatomically and physiologically. And this is where I want to give you some specific clinical knowledge that most men have never been taught. Let me start with an anatomical fact that research has only fully established in the last 2 decades, and that the majority of men, and many women, are completely unaware of. The clitoris is not the small external structure most people think it is. Research by Dr. Helen O'Connell and subsequent anatomical studies have established that the clitoris is a substantial internal organ, with erectile tissue, nerve endings, and vascular structures that extend several inches internally and encompass a far larger area of tissue than the external tip alone. The internal portions of the clitoral complex extend around the vaginal canal, beneath the labia, and up through the mons pubis. The entire structure contains thousands of nerve endings and is designed for pleasure in ways that go far beyond what is visible externally. Why does this matter after menopause? Because after menopause, the external glands of the clitoris can become more sensitive, and sometimes uncomfortably so, when approached directly before adequate arousal has been established. The reduced estrogen environment means the protective tissue around the glands is thinner and less cushioned. Direct, immediate stimulation that was pleasurable before menopause may now feel too intense or even painful before arousal is sufficient. What this means practically is that indirect stimulation becomes increasingly important. Stimulation through the mons pubis, the soft tissue above the pubic bone, through the labia, through gentle pressure that engages the internal clitoral structures, rather than direct contact with the external glands. Additionally, the research on orgasm after menopause is worth understanding clearly. Orgasms may take longer to achieve, may feel different in quality or intensity, and may require more sustained and specific clitoral stimulation than before. However, research also shows that women who maintain regular sexual activity, who have informed and attentive partners, and who receive adequate stimulation report orgasmic frequency and satisfaction that is not significantly lower than pre-menopausal levels. The capacity for orgasm does not diminish with menopause. The conditions required to reach it change. Become a student of her body as it is now, not as it was. Ask her what feels good today. Pay attention to what produces a response and what does not. Be curious, patient, and open to learning something new about a body you may have known for decades, because menopause has genuinely changed the map, and the men who update their map are the ones who continue to find the destination. What she wants, number 4, lubrication without shame. The fourth thing postmenopausal women want is something so practically important and so consistently mishandled that I want to address it with complete directness. They want lubrication, and they want it introduced without shame, without commentary, and without the kind of hesitation or significance that makes it feel like a problem rather than a solution. Research is unambiguous on this point. The reduction in natural lubrication caused by declining estrogen means that quality lubricant is a clinical necessity for comfortable, pleasurable postmenopausal sex, not a lifestyle accessory, not a last resort, and not a signal that something has failed. Studies show that couples who incorporate high-quality lubricant into their sexual routine report dramatically reduced pain, significantly increased arousal, and substantially higher sexual satisfaction scores for both partners. And yet research also shows that the majority of couples over 60 do not use lubricant consistently, and that in many cases the male partner resists its introduction, incorrectly interpreting it as a reflection of inadequate arousal or a sign that he is no longer exciting to his partner. This misunderstanding causes real harm. Lubricant is not a signal that something is wrong. It is a physiological accommodation to a biological reality, one that makes sex more comfortable, more pleasurable, and more satisfying for both partners. It is as unremarkable and as clinically appropriate as putting on glasses to read. Her eyes changed. Her vaginal tissue changed. Both deserve practical support without judgment or significance. Your role here is simple and important. Keep high-quality water-based or silicone-based lubricant available as a completely normal and expected part of your intimate routine. Introduce it naturally, without ceremony, without making it an event that requires acknowledgement or explanation. Just use it. Beyond lubricant, it is worth knowing that there are medical options, specifically low-dose topical estrogen available as a cream, suppository, or ring, that can significantly restore vaginal tissue health and natural lubrication over time. If she has not already discussed this with her doctor, it is worth encouraging that conversation. Lubrication is not the absence of arousal. It is the presence of care. Provide it without hesitation. What she wants, number 5, stimulation that doesn't center penetration. The fifth thing research shows postmenopausal women want is a shift in the definition and structure of sex itself. Specifically, they want intimacy that does not automatically center penetrative intercourse as the primary event, the goal, or the measure of whether the encounter was successful. Here is the clinical reality. Dyspareunia, pain during sexual intercourse, affects between 17 and 45% of postmenopausal women, according to research published in the Journal of Sexual Medicine. It is caused primarily by the vaginal tissue changes driven by estrogen decline. For a significant proportion of postmenopausal women, penetrative intercourse, particularly without adequate arousal, lubrication, and time, ranges from mildly uncomfortable to genuinely painful. When penetration is consistently the focus, the goal, and the expected conclusion of every intimate encounter, many postmenopausal women begin to dread or avoid intimacy altogether, not because they do not want closeness, not because they have stopped wanting physical pleasure, but because the specific activity that ends every encounter has become associated with discomfort. The solution is not to abandon physical intimacy, it is to expand it. Large-scale surveys of postmenopausal women converge on a consistent finding. They want more varied stimulation, more focus on touch, kissing, oral intimacy, and manual stimulation, more acknowledgement that pleasure, for both partners, does not require and is not measured by penetration. More encounters defined by mutual pleasure and connection, rather than by a specific anatomical outcome. What the research is describing is not a diminishment of sexuality, it is an expansion of it. A broadening of the definition of sex to encompass the full range of physical intimacy available to two people who know each other well, who are willing to be attentive and creative, and who measure success by shared pleasure rather than performance metrics. Men who make this shift, who genuinely release penetration as the definition of sex, and embrace the full landscape of physical intimacy, often discover that the quality of their intimate life improves dramatically. Because the pressure is gone, the anxiety is gone, what remains is genuine connection and genuine pleasure. Expand your definition, follow her pleasure wherever it leads, and measure success by her experience, not by a checklist. What she wants. Number 6, communication without pressure. The sixth thing postmenopausal women want is communication. Real, ongoing, open, warm communication about what feels good, what has changed, what she needs, and what she does not want. Delivered and received without pressure, without judgment, and without the kind of performance anxiety that turns an honest conversation into an evaluation. Research in postmenopausal female sexuality identifies communication between partners as one of the strongest predictors of sexual satisfaction, stronger than physical technique, stronger than frequency, and comparable in impact to emotional intimacy itself. And yet most couples over 60 have settled into a silence around intimacy that feels normal but is deeply costly. They assume they know what the other person wants. They assume the conversation would be awkward. They assume it is too late to start having it now. None of those assumptions are true. Here is what communication after menopause actually looks like in practice. It starts outside the bedroom. In a quiet moment, with no agenda and no pressure, you open a genuine conversation. Something like, "I want to make sure our time together feels good for you. I know things have changed, and I want to understand what you need now. Is there anything that has been feeling uncomfortable? Anything you want more of?" That conversation, approached with warmth, patience, and zero pressure for a specific response, is one of the most intimate things you can offer your partner. Because it communicates that her experience is your priority, that you are paying attention, that you are willing to change and to adapt. Not reluctantly, but because she matters to you. Within intimate moments themselves, the channel of communication should remain open. Gentle questions, "Does this feel good? Is this okay? How does this feel?" are not interruptions to intimacy. They are expressions of care that most postmenopausal women find deeply reassuring and genuinely arousing. Ask, listen, adjust. Ask again. This is intimacy in its most active and most loving form. What she wants, number 7, a partner who does not give up. The 7th and final thing I want to share today is the one that the survey data returns to with the most consistent and the most emotionally weighted emphasis. Post-menopausal women want a partner who does not give up on them. Not a partner who tolerates the changes, not a partner who adjusts his expectations downward and settles for less. A partner who shows up consistently, patiently, attentively, with the same interest, the same desire, and the same commitment to genuine intimacy that he brought to the relationship in its earlier years. Research documents what happens when a man's response to his partner's postmenopausal changes is withdrawal, when he reduces or stops initiating, when he stops reaching for her. The impact on her is not neutral. It is not experienced as consideration or respect for her changing body. It is experienced as rejection, as confirmation of her deepest fear, that her changed body is no longer desirable, that the intimacy between them was conditional on a physical capacity she no longer has in the same form. That experience, for many postmenopausal women, is one of the most painful parts of this transition. Not the physical symptoms, the withdrawal of the person they love. And it is almost always based on a misunderstanding. The man who withdraws is not trying to hurt her. He is protecting himself from what he experiences as repeated rejection. He has drawn the wrong conclusion, the one I named at the beginning of this video, and is acting on it in a way that causes harm without intending to. The research on this is clear. The women do not want space, they want presence. They want a partner who responds to her changing body, not with withdrawal, but with curiosity. Not with resignation, but with creativity. Not with the conclusion that this chapter is ending, but with the understanding that it is simply changing, and that what it is changing into, with the right knowledge and the right approach, can be among the most intimate and most deeply satisfying seasons of their entire shared life. Do not give up. That is what she is asking for. More directly and more urgently than almost anything else the research captures. Show up. Keep showing up. Learn what she needs. Provide it with patience and love. And refuse to accept that the best of your intimate life together is behind you, because it does not have to be. If today's video gave you something real, a new understanding of your partner's experience, a clearer sense of what she needs and how to provide it, a renewed commitment to showing up for the intimacy you both deserve, then please do one thing right now. Hit that subscribe button if you haven't already, and share this video with a man who needs to hear it. Because this information changes relationships, and it deserves to reach every man who is ready to use it. Every single week on this channel, I bring you exactly this kind of content. Honest, research-backed, clinically grounded, and built specifically for men over 60 who refuse to accept that the best years of their intimate lives are behind them. Leave me a comment below and tell me, which of today's 7 things resonated most deeply with you? I read every single comment. This channel is for you, every week, without exception. I'm Dr. Julia Rhodes. I'll see you in the next one.